Everyone, my name is student Dr. Berenice Jimenez. I am a third-year medical student from the Tulsa campus, and I am going to be representing myself and my colleagues on our QI research project for global health trips for student orientation and rotation information. Despite advances in medical student education, students report feeling underprepared as they transition into junior doctors. This study is going to look at the impact of global health rotations on providing that supplemental education and training for student doctors that are attending OSU COM. These rotations help offer early hands-on opportunities to learn skills in communication, clinical diagnosis, and cultural competency, especially where resources may be limited. Previous studies have found that students who participate in global health rotations typically score higher in knowledge of preventative medicine and public health exams, such as on NBME Part 2. Each rotation is unique in highlighting common health concerns and disease processes to local regions, especially for patients that are in underserved populations or regions. The goal of this QI project is to measure an increase in student confidence by 10% over the course of the most recent 10-day global health rotation, with plans to help improve student confidence and knowledge prior to even attending future global health rotations. Students were then asked to fill pre- and post-rotation surveys to assess the knowledge in various components, including pharmacy abbreviations, common disease processes, clinical use and dosage of medications, medical decision-making, presenting a patient case, and familiarity with SOAP notes. Question answers only offered objective answer choices to help allow for quantifiable data. So students were primarily asked to rate their confidence on each topic using a Likert scale ranged from 1 to 9. Data was collected from 20 medical students, both first and second years from both OSU COM campuses. Students overall reported a mean pre-rotation confidence score of 3.8 out of 9 for the previous metrics that we talked about. Students overall reported a significant increase in confidence for the metrics that we mentioned in the post-rotation survey with a 5.7 out of 9 confidence level. Also, 100% of responses indicated the preference for a detailed pre-rotation packet for future rotations, stating that this would greatly help increase their confidence. Here are two of the figures that illustrate some of the findings that we wanted to highlight. The figure on the top left shows the familiarity with standard global health track clinical components. We can see that there's a significant increase from the orange, dark orange, which is from our pre-rotation survey, to the light orange, which is our post-rotation survey. On the right, we also wanted to highlight the familiarity with common disease processes that were encountered and the confidence that increased with treating these before and after the surveys or the rotation itself. Four noteworthy conditions that we wanted to highlight here were GERD, URI or upper respiratory infection, UTI or urinary tract infection, as well as musculoskeletal complaints. We can see that these are the 4 areas that we saw the most increase. To conclude, this project's preliminary data from a single global health rotation demonstrates a benefit to student confidence in prescription abbreviations, managing the common disease processes, etc. All these metrics that we've already talked about. Thus, the systematic development of this approach to assess medical student knowledge will help guide subsequent preparation for future trips to come. Also, a pre-rotation packet has now been developed to help address all of these topics that were tested in the pre- and post-rotation surveys. Also, future surveys could further elaborate answer choices on the Likert scale, with 1 being not very confident to 9 being very confident, and with 5 possibly indicating not sure. Insufficient information from previous OSU COM global health rotations exists to establish an appropriate baseline to approaching students, especially with those that have limited clinical experience. Future studies, including additional surveys, will provide enough information to have data and perform statistical analysis and further insight to examine the benefit that GHTs or global health trips have on medical student education. Here are our references listed, and here's our contact information. I appreciate your time and thank you so much for listening.